Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 25th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 1,919, which is 61 new COVID cases since my last update Thursday and 16 since yesterday. I'm very sad to report we've experienced an additional death since last week, which brings the total number of COVID-19 deaths to 35 in Dubuque County. 8.3% of the over 23,000 people tested in Dubuque County have been positive overall since March, and the 14-day average positivity rate is 6.5%. As of yesterday, 9 Dubuque County individuals are currently hospitalized in Dubuque County. Now, this number does not include non-Dubuque County residents who may be hospitalized at our local hospitals. About 73% of Dubuque County positive cases have recovered to date. The state added 3,451 cases since last Thursday. As of August 25th, 2020 at 2 p.m., Iowa has a total of 57,282 positive cases. In all, about 1 in 5 Iowans, or over 602,000 people, have been tested, and about 9.5% of Iowans tested have been positive. Yesterday's 14-day average positivity rate was about 8% around the state. Deaths reported in the state total 1,050 Iowans. Currently, 295 cases are hospitalized throughout the state, and finally, about 78% of Iowans have recovered. So today I want to take a pause to remind everyone of what's happened since March and how it relates to how well we're all dealing with the pandemic today. Back in March and early April, things were happening very quickly around the country and even in Iowa. Although Iowa was not yet having large surges of cases, Governor Reynolds made proclamations with significant impact, including closing schools, retail establishments, places of worship, salons, etc., along with restrictions for testing, healthcare providers, and hospitals. As a nation, back on April 10th, we were experiencing a 7-day average of over 39 cases per day. This is when New York City was experiencing its surge, and I think we all remember seeing and hearing about the dire scenes in the hospitals there. Iowa had between 1 and 200 cases per day. During that time, we were basically in a lockdown situation or stay-at-home situation with very little socializing. Then in early June, the U.S. average positivity rate was just over 21,000 cases per day, which was probably a result of the significant public health measures instituted by states around the country. Iowa's cases were in the 300 to 400 range per day, and Dubuque was experiencing daily cases in the single digits. Yes, that was under 10 per day after having higher numbers in early May. In late May and early June, many restrictions were lifted in the governor's proclamations, including socializing with others outside your household, the opening of retail stores, restaurants, bars, and services, and the ability to hold community events, all still with social distancing and some other public health measures in place. Then, in late June and early July, the U.S., Iowa, and Dubuque County began to see a resurgence in new cases, particularly in the young adult population. In fact, for the U.S., from June 8th to July 25th, the 7-day average was over 66,000 cases. That's twice as high as it was back in April when we thought things were really bad, and a threefold increase since early June. Dubuque hit its all-time daily case count of 99 on July 2nd. As of last week, the U.S. 7-day average was just over 50,000 per cases per day. Iowa and Dubuque County are still on a downward trend for new cases and deaths. I'm reminding you all of this because it seems like we've turned a little complacent to the public health measures, distancing and socializing. Call it numbness to news information overload, viewing COVID as something that is now no longer acute but more ongoing and chronic. Or the more we hear news and soaring case information about COVID-19, The less we pay attention, we even begin to think it's not as risky as once thought. Maybe even become desensitized. It just happens. And then we begin to let our guard down. Today, I'd like to suggest that now is not the time to lighten up on physical and social distancing, hand washing, being in crowds or enclosed spaces with groups of other people outside your own household, not wearing a mask or face covering, and most importantly, disregarding isolation and quarantine recommendations for if you're sick, test positive, or are exposed. Keep in mind, school started this week, along with our local and state colleges and universities. Although our public health incident management team is working daily with the schools, and they all have done extensive planning, think about the potential exposure that will occur with schools and their related activities. Now, I'm not saying schools shouldn't be in session because we know how important that is for learning, but it's all the more reason to adhere to the public health measures and directives in order to not add risk to not only our students and teachers, but all the vulnerable people they and you may come in contact with. Thanks for tuning in today. Remember, let's not forget the illness, hospitalizations, and deaths that have occurred in our community as a result of the pandemic. There still is no cure or vaccine. Risk is with us and our loved ones, and especially those most vulnerable. And remember, we're all in this together.